Am I getting too big for my HIPAA britches? Am I the next Aaron Brockovich?
You're listening to the Help Me with HIPAA podcast, where HIPAA and humor collide to make learning fun. Your delightful hosts are Donna Grindle and David Sims. Relax, HIPAA help is on the way.
This is Nalia from Georgia Spine and Orthopedic in Tucker, and you're listening to Help Me with HIPAA podcast.
Thank you for the intro. I am David Sims of HIPAA for MSPs and Security First IT, and joining me is Donna Grindle of Carden. Good morning, Donna.
Good morning, David.
How have you been in this getting closer and closer to post-COVID?
You know, by the time this comes out, who knows? You know, we do that 2-week thing, which is great for us because we can manage it. But boy, during this mess, it's like by the time this comes out, we could be living in a different world.
Yeah.
Literally. 2 weeks.
Well, the other day I was talking to one of my techs and asked him a question about a project, and he said, that was like 12 days BC. And I was like, what? He's like, 12 days before COVID. COVID. I was just like, seriously? It's a timeline now? It's 12 days before COVID?
Yeah. It's going to be BC or AC now, I guess. But then where's AC start, right?
Well, yeah, that's what we don't know.
It'll just be BC.
Yeah. So I thought that was funny. It's BC.
Yeah, that's good. So I think that as far as what we can do, the session we have planned today hopefully would be helpful.
Mm-hmm.
By the time it comes out, it hopefully will be, we think.
Yeah.
Yeah, because we already did what kind of things do we worry about to reboot the business, and we decided let's make a checklist or at least a specific task to consider.
Yeah. So back in episode 248, which darn seems like last week, but it was actually like 7 weeks ago. We did how do we reboot our business? And of course, we know people are always dying for checklists.
Indeed.
So today we're going to go through a checklist of things to consider as you are reopening and rebooting your business. And of course, we talked a lot last week about it too, which is, you know, what kind of stuff crawled up in there while you weren't around? You know, it's kind of like when you go on vacation for a couple of weeks, you come back and it's like, how did this spider web get here? And, you know, why is there all these anthills in the yard now and they weren't there a few days ago? It's like, all it takes is just not being around for just a little bit and stuff just starts taking over.
Yeah, just look away.
I know.
Like when small children are around.
Oh, yeah.
You know, I just glanced at the flies that went by and they were able to pull that whole shelf off. So,
yeah. So we'll get into that in a little bit, but we do want to go through some cool stuff. One being, you know, the boot camp, and then we want to talk about some listener questions and email that we got that's been pretty funny.
There's some good stuff in there.
Yeah. So let's talk about the boot camp because that's been up in the air and back and forth, and I think we've landed on something.
Well, sort of.
Close.
It's not locked and loaded.
No, it's not locked, but we're getting closer.
Yeah. I think that by next week we'll make a specific announcement with a specific date and all of those kind of things. But I think that you and I agree after we've put it in the background, you know, we let it background processing work for a while, that for this year, we need to attempt, and, you know, we're all trying new things, a version of a virtual boot camp, but we're not going to do it like an online course. It's literally like an online meeting that will last for 3 days.
Mm-hmm.
And that's what you would do if you were here. So, you know, and I'm, you know, really looking forward to things that would happen like, you know, at the Supreme Court when somebody flushed the toilet. That is just precious. It's like the Archie Bunker moment of Supreme Court oral arguments. But we're going to do something that's uniquely ours because that's what we do. That's how we roll. I think that people are like it, or at least we'll see if we can make it as close to being together without being together than ever before. So we'll see. But by next week, we will have it. And so we're going to do one big one. It'll be very limited seating because of that. But we don't know that we have the ability to do multiple ones just because of what it will take for us to do it this way.
Yep. So going virtual.
Yes.
But
so
it doesn't
we know
mean-
we're doing it. And right now it looks like we will do it in August.
But just to be clear, though the meeting will be virtual, we are not teaching a version of HIPAA that is virtually HIPAA.
I know, right?
Let's make that distinction.
And we can tell you right now, there's going to be, you show up and that's how you get it. It's not like you get recordings that you can watch later. You're either here or you're not. And we're doing that for many reasons, but we all know we don't participate well if we're not required to be there to get it.
Mm-mm.
So
That's
we
one
need
of my
that
first
commitment.
questions. Like,
Yeah.
is this going to be recorded so I can not show up?
Yeah. And then when do you listen to the recorded version?
90% of the time, never.
I know. So we're not doing that. And we're also saying, look, you need to not be sitting at your desk because we all know we can do that now.
Yeah. All the other distractions there.
Right.
So,
Yeah. You're normal. We don't want anybody seeing you at work just like you're at a conference.
yep. You have
All
to turn
the
your
stuff.
video on because we got to see you.
That's right. You have to have video, and we're going to make fun of you if you're not paying attention, just like we would in person.
Yep. So, but anyway, there's some logistics around how we need to function and do this to make it engaging and fun and all that, and we'll figure all that out. So
Yeah.
I'll probably make the trek to Donna's place to set up the studio, so she and I can practice non-social distancing.
I'll
We'll
be
make
wearing
sure-
my mask around you. You're not trustworthy.
I'm not worried about you catching anything. You keep enough antiseptics in you during that time frame anyway.
All right. So look forward for more details next week. And we will probably by the time you hear this, there will be information on thehippabootcamp.com that's going to tell you all about the COVID version
The
of
COVID version.
HIPAA Boot Camp.
So outdoor restaurants have now started to open around here. What about there?
Yeah, come on. It's a mess down here, and you know it.
So I went a couple days ago to a pizza place. They have outdoor seating. So got me a pizza, and the lady comes out, takes my order, and she goes, "What can I get you to drink?" And I said, "Do you have Corona?" And she looks at me like, "Seriously?" And I'm like, "I am not joking. Do you have Corona?"
You know, the beer.
The beer. And she goes, "Oh." And I'm like, "Oh my gosh."
Yeah, poor them.
Anyway, so yes, I had Corona and I got rid of it quickly.
There you go. Well, these are the things that we are all going to be figuring out. You know, so we'll sort it out. We'll figure it out as we go. But there's going to be some screw ups and some crazy. If people will just not be stupid. And there's so many people who think that this is not really true. It's fake. And these people didn't die. It's like those people who didn't think we landed on the moon.
Or we had a
No, there's-
Holocaust.
There's no Holocaust. Even now, the earth is flat. That one I don't get at all. We have had people on the moon looking back
It's a flat
at
disc.
Earth. Yes.
So
Yes, if you're those people, we need to have you just kind of hold on for a minute and let everybody else get through this, and then you can go back to what you're doing.
yeah, those are the same people that use 2 Ps in HIPAA.
Okay, so please, people, you know, let's act like we're in a civilized society And
She says from Georgia.
hey, look, there's a reason I'm making the plea. I see it. I see it around me.
I know. That's what I'm talking about. All right. So let's take a short break, and then we're going to get into some listener questions. How about that?
Yes. Cybercrime is a multi-billion-dollar industry and growing. How confident are you that your computer network can withstand a cyber attack? Can you afford to take the chance that what you have today will protect you? Call us and find out if the cybersecurity in your business is something you should be concerned about, or if you can rest easy knowing your business is protected. Visit us online at securityfirstit.com. That's securityfirstit.com and schedule a time to talk.
Did you know that 83% of healthcare organizations report a strong negative impact to their bottom line after a data breach? So many doctors think that they're HIPAA compliant and have nothing to worry about. Many of those organizations thought the same thing before it happened to them. Call Cardin today at 678-292-5001 so they can assess your practice and help ensure you are protected and prepared. Visit cardinhq.com to learn more. All right, we're back. So, listener questions. Are you ready?
I am ready.
All right. So, you want to cover Mr. Elliott?
Yes.
And it's not the, Mr. Elliott from the TV show.
No. or Wild Bill Elliott, if you're from down here.
Yeah. Mr. Robot.
The bigger questions that we get sometimes, so we have to have background information and all those kind of things to be able to answer. So I'm going to try to summarize all the background stuff that Randy Elliott sent us, asking all kinds of things that he's finding when client asked him to, quote, help them with HIPAA, which he thought he was pretty funny saying that, and I did too.
Yeah, I know. I heard to-doom as I read it.
He reports that our podcast has been an invaluable resource to him.
Mm-hmm.
Glad to know it.
Yes.
And frankly, when we're reading that, we were not surprised that the MSP only handled a few things and not all the things that they were now hiring him to do.
Yeah.
And he gave us a pretty substantial list, and it included interesting things like, finding unencrypted laptops. Not shocked.
Mm-hmm.
And then, he's listened to us. So things like the key to the shredder, I'm assuming he's talking about the shredder box, the key to the shredder stored on the shredder.
Yeah. That's like taping your passwords to your keyboard.
Yeah. So he's found a lot of those things. And in the process of all of this stuff and the COVID thing, the website came up, the practice's website. And he asked, so who maintains it? And there was this, you?
That's a great question.
And he goes to looking and he sees that there is a Gmail account sending an email to an Office 365 account when someone completes a form requesting an appointment.
Okay.
And the form included a field called reason for visit. And that little box was in the options. It wasn't required, but you could fill it in.
Mm-hmm.
So at that point in his email, he gets to, so my question.
Yeah.
Is there a way to get this information in a compliant manner? What do other practices do? They do have a portal with their EMR, but for a reason I've forgotten, either can't or don't want to use it for this purpose.
Mm-hmm.
Thanks. You guys are great. Okay. So I explained to him you could make G Suite account compliant with a BAA, but as I was writing this up for the show, I realized he had really said Gmail, not G Suite. My bad, dude. I was doing it on the fly. But often groups that we work with, we just have them remove stuff like that from the form.
Mm-hmm.
That's the fastest and easiest way to do it, because you're going to talk about it when they call anyway.
Right.
Most of the time, no one even looks at that. And you're going to get more when you call them. So we just changed the form to be more like, give me a call kind of wording instead of I want an appointment.
Mm-hmm.
and that makes it less PHI-ish. I just made that word up.
Yeah.
But obviously, and there are groups that do websites, and I sent him some names of some folks that we've worked with that may be able to help out. So we'll see. But thanks for sending in your story that you are helping them with HIPAA after we've been helping you with HIPAA. Glad to know we could help you, Randy.
Yep. Lots of helping going on.
We're helping.
But it does, this does point to a couple things, which is we always say, number one, security is not just the job of the IT provider.
Right.
And two, it also goes beyond technology. So in his cases, he had some technology things with the laptops, but he also had keys stored in places they shouldn't be stored, which is physical security. So, good for him for picking up on all those things and understanding that privacy and security is not a technology thing, and it's also not something that is outsourced 100% to somebody else.
Well, and as a tech person, when you're sitting there and you're waiting on something to run or something to reboot or whatever, and you look around looking for problems. Ask questions. They expect you to know this. Now, I've had cases where, people mouth off at me. I'm like, hey, no one's there. And that's not logged out. And it's just sitting here in the hallway. And they're like, I don't care. And I just say, okay, I'll go tell the HIPAA person. It's not my problem.
Yeah.
But
this is also the problem. Like I had a conversation last week with an MSP. And one of the things we discussed was the fact that when MSPs outsource their compliance that they're doing for other people, you know where I'm going with that?
Yeah.
Part of the problem is they don't get familiar enough with what HIPAA requires, and so they can't recognize these things because they've outsourced all of it and they don't know it. And so they can't sit there and say for sure where these issues are because all they know is, hey, I've got security.
Right. Yeah, it's that belief that I don't have to do it with HIPAA myself, which is not true. But let's not go down that rabbit hole, at least not on this topic.
Okay, we won't. So let's get to the next one that was...
She cracked us up, man. It was
rather funny. I honestly, I was a little bit, like at the end of the first sentence, we were accused of something, and I'm like, oh, God. What did we do?
That's great. So in this one, she started with Donna and David. She has our names in the right order.
Yeah. Jen. Hey, Jen.
Hey, Jen. How you doing? This is it's really one of the best first lines we've ever had. There's a new sheriff in town, and it's me. And it's because of you, too.
I know. I was like, okay, this is interesting. Yeah. Are we being blamed or congratulated? I'm not sure.
I know. It could go either way. And then Jen proceeds to tell us that she is works at a medium-sized physical therapy clinic in southwestern PA and was delegated the role of HIPAA compliance officer.
Delegated.
Yeah, voluntold.
Exactly.
That one. If you weren't at the meeting, you got the job.
Yeah, you didn't step up. Everybody else stepped back.
That's it. So I have been reviewing and updating our BAAs and found that one of them, our reminder call service, had refused to sign our BAA back in 2016, and we had only signed theirs. Good news, you did have one.
Yeah.
So, but she wanted to get things in order, so she calls them up and sends over a new copy, and they go, no, we don't sign the BAAs from CEs. And, quote, our agreement should cover any legalities that would be in yours.
Okay.
Then she said, okay, well, she pushed further, asking for, okay, give me risk and security assessments to have on record, or give me more specifically how they are HIPAA compliant. And he said he can forward my request to the legal team, but, quote, I probably wouldn't get anything on paper. So we're not going to tell you what we do.
That's comforting.
Yeah, I know, right?
Yeah.
How many times we just talk about vetting people?
Yeah, it's hard to put
just
something on
did
paper.
HICSCRIM.
Yeah. When you don't do it, it's hard to put documentation to it.
I know, right? You should send them HICSCRIM to get their attention.
Mm-hmm.
But I didn't think about that. But the HICSCRIM episode, yep, send that to them. So my question, I know we can just stop using them, but do I push harder before terminating? Should things like this be reported to HHS? Can I say, legally, you have to sign hours, or our documentation system company recommends this reminder call service? Should I contact them to let them know that the call service is not complying?
Yes, and yes.
But then she ends with more humor that really made me bust out laughing. Am I getting too big for my HIPAA britches? Am I the next Aaron Brockovich? Love the podcast so much. It's so helpful and snarky and fun. Thanks so much. Okay. First of all, HIPAA britches. I couldn't stop laughing for a little while.
Yep.
And the whole, I had this flash of Julia Roberts in cutoff shorts demanding her HIPAA rights.
Yeah, Jen's got her cleavage showing. I need to see some HIPAA stuff.
There you go. So we're glad we're here for you. And this one, it's a tricky one. We always go through it. But that whose BAA, mine, yours, or ours, often the larger entity wins. You're never going to get Amazon or Google or anybody to adjust theirs. But you can usually challenge the terms.
Heck yeah.
And make sure that you let them know you're paying attention. David, we just discussed this a few episodes ago where David got in a fight with Barracuda.
I got in a fight.
It was a terminology fight. It was a word fight.
Yeah,
but know that you can choose to report to HHS on the complaint portal your concerns. But keep in mind that OCR could ask you about your program, which is what just happened in the first settlement of 2020. If you go back and review it, they reported a vendor, and then, but if the vendor is particularly unhelpful, it may be worth it if you feel like you've got yours in control. But I would definitely go to the people that are recommending it and not just talk to the salespeople, the support. Ask to talk to the HIPAA officer.
Yep.
And now, if they don't take things seriously, you might not get far, but it may tell you something else. You need to just tell them to listen to Help Me HIPAA and get back to you. Send them HICSCRIM. But your best bet is to use that company along with yours to put pressure on the vendor to get their house in order is really what I would say.
Yep.
It's unfortunate, but this is not uncommon.
Mm-mm.
But make sure that you can do the phone, but after that, you need to put everything in writing, including your concerns. And then if you need to terminate, keep in mind that the BAA should have termination language in it that says, if I feel like you're violating HIPAA or any of the terms of this agreement, I can give you a notice in writing and give you 30 days to cure it. And if you don't, then I can get out of our other contracts too.
Mm-hmm.
So in the interim, while you're doing this, I would start looking for another vendor because I'm not expecting that to go well.
Yep. So my fight can be listened to on episode 233. But
Okay.
But Jen or Aaron, whoever you want to be, I say fight it. I say go after them. Make them
Have some
sweat.
fun with it.
Make them sweat. Show them your HIPAA prowess.
Well, know that if you do get them to act, you're helping all of their clients
True.
and all the patients of all of their clients.
True.
So keep that in mind.
Mm-hmm. So, and keep us posted. We want to know.
Yeah, we do want to know.
I want to read about it on the news.
And then a quick in other news, there is another alert that came out from CISA, the Cybersecurity Infrastructure something agency. They're pointing out that APT groups targeting healthcare and essential services, they made another announcement about it. That should tell you something right there. And let's make sure that if you aren't a nerd, these APT groups, they stand for, APT is Advanced Persistent Threat. And it basically is the term where we talked about before that the criminals are very good and they're sly and they are in your network or in the network of your business partners coming after you. They're in there messing around. Keep that in mind. And the quote from the alert is, the pandemic has likely raised additional interest for APT actors to gather information related to COVID-19. For example, actors may seek to obtain intelligence on national and international healthcare policy or acquire sensitive data on COVID-19 related research. So if they find that your healthcare, they'll use you as a launching pad or a way to snoop around and find a way to more information, who you're connected to, how we can, use you to access somebody else.
Mm-hmm.
So just know that.
Just know that. All right. So CISA, Cybersecurity Infrastructure Security Agency. Or actually, there's an and. Yeah, Cybersecurity and Infrastructure Security Agency. Yeah. So security's in there twice, so it throws you off.
It always does. It bothers me. I always feel like I'm missing something.
They should say cyber and infrastructure security.
But good news is they're worried about security. So there you go.
They're worried about the cyber.
The cyber.
All right. Ready? Checklist. Grab it. Let's go.
Get it and go.
All right. So lots of things to consider, right? So
yeah, boy.
Got all kind of various employee related issues, like, some of them want to come back to work, some of them don't. Mm-hmm. Someone's going to have financial issues. What about your business plan? Because I don't know about you, but my business plan, I just threw everything in the trash for 2020. I was like,
just burn it. Boom.
I was like, everything, just throw it in the trash. We got to start all over.
You didn't take it out and use it as target practice.
No, I've got metal targets for that.
Okay.
But so, we definitely, one thing we learned is how important technology is in running the business, because now everybody's like, oh yeah, I didn't think IT was that important, but now I know. We need it for remote meetings, and we need it to remote back into other systems, and we need it to do this and do that. And now all of a sudden, us IT people are like, yeah, see? we are
told
valuable.
You we could do this.
We are valuable.
But there is a great deal of need that, because now we've really started to understand what technology can do, you can't take it away.
Mm-mm.
People don't like it once you take it away if they know they can do it. So keep that in mind, because we understand those are great, but things were kind of slapped together to make that work.
Mm-hmm. Sure enough.
So here are, and it's, we're calling it a business reboot checklist, but it's more of the tech reboot check. I don't know what to call it, but I see it as multiple projects.
Mm-hmm.
Right. And that you should probably sit down with your team. And another thing you've really learned now, who's your team?
Yeah.
Who's your peeps? Who's the ones that are actively finding ways to take care of the job we're supposed to be doing?
Mm-hmm.
But get with them and kind of break out some of this work. Don't take it as you've got to do it all, first of all. And, we always say that. You need a team.
Yep.
You need your champions.
Yeah. Which sometimes is your shadow IT people.
Yeah, but bring them into the fold.
Yeah. But look, you want to help? Here we go. We're going to put you to work.
So the first place that you need to start is document all the changes that you've made.
Yeah, which is going to be hard if you haven't started.
Exactly. So if you haven't already, and if you did, make sure you pull it all together, because you could have documented stuff all over the place in emails and all these kind of things. Pull it all together, because you need to have a story of what happened during this time.
And if you haven't started documenting, then I would put somebody on doing an assessment of that. So let's say you didn't document the remote working from home deal as far as remoting back to the office. So nobody documented how that was set up. Well, then do an assessment of it. Send somebody in, look at every single setting. how was it deployed, what got turned on or turned off, and just do a complete assessment of that, like they should have done in the beginning. And that way you have your documentation.
Well, and most people didn't have time. This was done on the fly.
Yeah.
But your tech people should have some documentation. And no, they don't like doing it. Tell them to eat their broccoli and get it done. But with the information about who was able to work remotely, what were they able to do, what equipment changes, what did you add, what did you pull out of the closet and blow the dust off of? But make sure those things. But, did you buy, lease, borrow, or share equipment with somebody else? And don't forget, did you use employee devices?
Ooh, yeah. And we had, everything we had that could be borrowed got borrowed. And, fortunately, we, as soon as we get things back, we always nuke and pave, make it clean. So, but that's a question, if you borrowed from your IT vendor or somebody else, was it prepped properly, or they just handed it to you from the last person that borrowed it?
Well, if you didn't borrow it from IT and you borrowed it, from your next door neighbor, you got a whole new list of things.
Yeah. It's like, there's this guy, we don't know who he is, but he's just coming around handing out laptops left and right. It might be concerning because you know what? If I was a criminal, I would go straight to a healthcare provider and say, I have a bunch of laptops that you can borrow as long as you need them.
Yep. I'll be right back, and, don't worry about it. I'll set them all up. But the importance of this is not to solve the problems, not to figure everything out, but make the list of stuff that happened.
Yes.
Even if you don't know all the details, put it on the list that you don't know all the details. If you don't have that list, then, you should figure out stuff like, what did you reallocate equipment from something it was doing to something new? We moved that. We don't need that because we're not in the office doing that. So instead of having it run for that test, we moved it over here for remote access, or somebody took it home. Well, now do I have different things on it? Did you implement new software?
Yeah.
And I think a lot of people did, man.
Yep.
Whether it's mobile apps, communication tools, there's new software. There's a new sheriff. But that, the ability to communicate between staff, customers, or patients, all those new tools or devices, you need to make a list of those because you won't be able to keep up later.
Yeah. And just know that some of these tools, you may have used them for remote meetings and things like that, but some of these tools have remote access properties built into them. And so you need to understand that somebody could remote into your machine using that software. So if you don't need it, get rid of it.
And keep in mind that you may have had to change access controls for systems, applications, users, those kind of things. You may have to turn on things or turn off things. Mostly you turned on things, is my guess.
Turn off all the security. We can't get things to work.
Did you use new tools to share information between your staff and your customers or your patients? Now, I use the example of Dropbox, not because I think you should use it, but I could see people having done that because that's what they needed to do to get the job done.
Yeah.
If you did that, and you need to know, you need to get the input from all of your people. Get everybody involved. Have them make a list. Here's the things, technology. I'm not asking you to tell me about what hours you worked or any of those stuff. I want to know what tools you used. How'd you make phone calls? And it doesn't matter right or wrong. I gotta know because I can't deal with the flip side of it. And what about the staff that you furloughed, you laid off, or they resigned, or they took a long leave or leave of absence because of this? Did you deactivate them? Did you do your termination checklist? Because
but we might bring them back next week.
Well, yeah, you can still bring them back. But as we mentioned on the episode that came out today, we need to rethink our threat list, because if you've still got those people with the ability to log in and they're mad at you, Hello.
Mm-hmm.
It's a big problem. And then the big thing in healthcare, huge, huge, huge. Now, all of those things really apply to business associates. It really applies to all businesses, not necessarily healthcare. All of those things, every business needs to do. Document what happened. You know, we're working, even today, we're reviewing and documenting clearly how we got to the numbers for our PPP and, you know, the SBA stuff, how we got to the numbers, where we got there, what was our plan, financial plan going into all of this, what were we thinking and doing, you know, what deals were we trying to close, all those things before this happened, and then all the decisions we made as far as how to spend that money based on all those plans and how we got to that number. We're documenting all that because we practice what we preach up in here.
That's right.
But, you know, there's plenty of things that we had to do to adapt, right? And one of the big things in healthcare was they started finally, telehealth solutions just blew through the door, you know, and everybody was doing everything, whether it's audio only. And every time you turn around, CMS was sending out notifications of what was okay to do. First, it was like, you can use FaceTime. And then people are like, they got a flip phone. And, you know, it's Medicare we're talking about here. So they had to keep adjusting those things. And then, of course, you had OCR with their enforcement discretion kind of announcements. But again, this telehealth is out there now. The cat's out of the bag, so to speak. You're not going to get it back in.
A lot of people figured out that they could do business in different ways that they did not know they could, or they, thought it would be too problematic. And this just gave them opportunity to test drive some things and see if it worked.
Well, and there's a lot of folks that really and truly say that, yes, this is opening up new things and you should reconsider the services you provide and how you provide them.
Mm-hmm.
Because now you've learned.
Yeah, I don't know about you, but I kind of like the curbside service I'm getting in all these restaurants. It's like, bring my food out.
Well, I know. I have a dentist appointment, and, our dentist is, well, I don't have to go into that, but I've gotten a questionnaire, and it's asking me all these questions, and then you're going to pull up in the parking lot and call a number to let them know you're in the parking lot. And then they're going to come down, they're going to take your temperature, they're going to go through the questions again. Then they're going to let you know when, and take you straight to the room from your car.
Mm-hmm.
And then when you're done, they're going to organize you another way. So, there's a lot of things that they're having to do. And there's a lot of things they found out they could do with telehealth.
I think it's just like recline you back in the car and just start working. Just hook it to the tailpipe and you'll be out in no time.
Can you see the dental hygienist like trying to get over the seat and lay you back?
Yeah, I had a horrific event as a kid there where a dentist literally did sit on top of me.
Oh yeah, that'd be now we know, people. Now we know.
Yes.
That answered so many things. Okay, so you go through and you document all the things that you've done to survive. Don't skip a thing. Go find all the emails where you were discussing your options and notes and stuff. Get it all together. Because here's the thing that most people aren't thinking about right now. A year from now, something's going to come up and you're going to realize it happened during this time.
Mm-hmm.
And if you don't know these things, you're not going to remember them a year from now.
Yep.
So get that information, sort it out, and remember these things go on for months. We're going to need to keep documenting. But then you need to lay out, okay, here's all the things I'm going to need to do to put it back together. Now, I know that we had to do X, Y, and Z. We had to switch everything out. So like with you, David, you're looking at it and saying, do I want to go back to business exactly the way I was before?
Yeah. No, we've already decided we're not. because this
Right.
is, for us, this was a trial run at doing something we looked at doing anyway. And so it just gave us not really an excuse to do it. It really gave us some flexibility to do it and have some forgiveness from clients should things be different from a client perspective.
Right. It does. It lets everybody see how it works.
Yep.
Right.
Mhm.
And from a lot of people's perspective, they may not go back to operating the way they were before. They may provide the same services, but they now may do it a different way.
Mhm.
And then you've got all the things, that we've talked about. They either have to be undone or you got to figure out how you're going to implement them into your business model now. So like with you, we're going to we're going to save some money and do remote work so that, I personally have done it for 20 years. It's
Yeah. Well, it's honestly, it's not
a
even
great way to do it.
It's not even really for us. It's not even remote work. Just like for
Right.
you're not really working remotely. That's your office.
There's no office.
Right. And so for us, it's not, I'm not remoting back into our main office. I'm functioning the way I've always functioned because we're a completely cloud-based company. So I know it's just kind of semantics, but for us, it's not really remote work. It's just being able to have a distributed team versus a team in one place.
Exactly. Distributed team.
You like that?
Well, that's it. And so the other piece is, with the employees now learning how to do remote work in the cases where they are, or distributed teams, whatever you want to call it. How are you going to deal with that? Did it work? Did it work well enough that you should consider that as something that's a feature that you offer, or a benefit that you offer for certain employees? Or, like you had every Friday, right? Everybody did that anyway.
Mm-hmm. Yeah.
All right. So do you start including those things? And do you add new services from what you've learned now? That you can do things differently than what you ever did before. So we're going to deal with this new world now for a while where these infections are a problem, and you've got people who need to be isolated from the potential of infection because there's so many variables.
Yeah. Well, I'll tell you well, we'll get into it in a minute because you're going to talk a little bit about taking advantage of opportunity. So
Right.
Go ahead. When we get there, I'll cover this story.
But you've got those two lists then, and now you assess that impact that the changes have made. What happened, and what are you going to do about it? You've got to have a plan to assess the privacy and security of what's happened.
Mm-hmm.
And while you try to put it back together, and, as our friend Ben Franklin says, or supposedly it's attributed to him, failing to plan is planning to fail.
True.
Supposedly he also said beer is how we know God loves us. So yeah, I love me some
That's
beer.
what happens when you're playing with lightning.
I know, right? But if you're going to ignore Ben Franklin's wisdom, you could be looking at a lot of Ben Franklin's on some paper money that you're going to be having to pay out, is all I'm saying. Because if you don't start and make a list of projects, break it down into manageable parts so that you can figure all this stuff out and put it back together and incorporate the new things. And remember, we just talked about how scary the new stuff is. And here was another report coming out letting you know that they're trying to get in and take advantage of this. And there's nothing we can do. It's criminals. That's how they work. So any of the applications that you've implemented, all of those kind of things, you need to consider, did you bring in forensics folks? If you made a ton of changes to your network, I honestly would encourage you to bring in a forensics team and let them just do a scan. Let's let them do their little thingy to figure out how it looks.
Mm-hmm.
If they don't see anything, then you got a little bit of comfort.
Yeah.
Now, if you made a lot, then hopefully they could find if they've already been in there. But keep that in mind. That's all I'm saying. You don't want to get it all put back together and then find out it all locked up from ransomware 3 weeks from now.
True.
that would be, catastrophic to some people.
Oh, yeah.
And that's why you should take these precautions in the beginning, because the risk of it happening 3 weeks from now is that bad, right? It would be catastrophic if it happened potentially to a lot of folks. They wouldn't be able to handle it. Make sure all of this stuff, you can change passwords after you've gotten everything scanned and you made sure your vulnerabilities, all of that kind of stuff. Wipe devices that need to be wiped. That all needs to be in your plan. So take the plan, the documentation of what you've done, and the documentation about where you're going to go, and that should give you, okay, now I've got to build a roadmap that gets me from here to here.
Right.
And consider every single device, every single application, every single connection even needs to be cleaned up in some way. It's like we blew up the house. The parents were gone. The kids had a party, wrecked the house, and they got to put it back together. Now, that they may have moved some furniture around and say, hey, I like it better over here. Great. But you better put that house back together, because the parents are going to see it's going to be a mess. But again, take advantage of the opportunity. You'll rarely ever have this opportunity. I mean, I've never had it where you just wipe it all out and potentially build it back again.
It's called divorce.
Yeah, but you still have those stragglers in there.
Yes. They're grown and gone now.
Yeah. But it is something, if you were able to function securely without some things that you thought you needed and now you don't, like David, I don't need an office. I can just not pay that rent and save some money to help me get back on my feet. Did your policies and procedures adapt well? Is it time for you to revisit some of the policies you had in place? Didn't need to be that way, and you changed them and adapted them. Then you need to make sure that you implement them properly and evaluate where things could be done better or faster or easier or more efficiently or cost effective. You've learned a lot. Take the time to experience the opportunity and treat it like an opportunity, not something that is a burden. It is an opportunity.
True.
Preach it.
Well, another part of the opportunity, and you covered it a little bit, which is the opportunity to see how you want to function as a business afterwards and where some opportunities are to do things differently that will improve either your business or it'll improve the experience that your patients or your customers are having with your business. So look at things like that. And I had a recent conversation with a chiropractor, and one of the things he's looking at, because he's never had to use Zoom before, and not only is he using it, but tons of his patients are using it. And they're not using it for telehealth, but they just have conversations, and he's hearing all these people talk about, I use Zoom for work now, and I'm learning it as I go. And he's like, yeah, we're learning it and all that. And so he's kind of telling me this story, and he's like, I'm wondering if there's a way for me to use Zoom to do something in my practice. And so we got to talking, and one of the things I asked him was, what's one of the things that's difficult for you to accomplish in your practice? And, because I'm looking at, is there a way that technology can help solve that? And so for him, he said, well, one of the most difficult things is getting people to do these exercises that we give them from home, because they come and they get adjusted and they do these little exercises here, and we keep track on charts and all that. But then we say, all right, you have to go home and do this, because otherwise you're only doing it, once a week, and we really need you to do it multiple times a week. And so he's looking at, can I take something like Zoom, and can I have almost like an online workout session for everybody who's doing these particular 3 exercises, so that, 1 hour on Monday, Wednesdays, and Fridays, we're going through this exercise session so that everybody can come in and do that. And that would hopefully increase the amount of time these people are exercising, which would make their results better. dealing with his practice. And so I thought that was a pretty good idea, and he's not implemented it, but he's thinking about it. Like, how can I leverage technology that I didn't know I could use before this in a way to improve results of my patients?
Yeah, my sister, when she had her knee surgery last year, it was amazing how well that group had implemented for the therapy part of it every single day from the time I took her home from the surgery center. Every morning they would do a recap with her, and she had certain things that she had to report in, and they would even ask for video of her doing things. And she would tie into this app and do it all. That it is the way we need to do it in the future.
Yeah.
For many reasons. She didn't have to go into the office. Hello?
Yeah, that's exactly what I was going to say. I mean, having to drive in somewhere and do something that you could do from home, or, it's like, I don't have to be here and I still have to drive here and wait in the waiting room and go through all this stuff. If you can cut that out and you don't have to make that happen, man, that is, I mean, you're saving people what I consider the most valuable thing I have, which is my time.
Well, not only that, but now I don't have them exposed to all the other people. I haven't had to have extra room to accommodate more people to do their therapy. And I mean, there's a long list of reasons these are great things. Yep. So use the opportunity, people.
Yes. Yep. Take a look at things.
Technology can do it, but make sure you do it securely. You have to think it through. Don't just slap it together.
Just because you can doesn't mean you should.
Yeah. Any of those things where you counted on the enforcement discretion, that can get turned off at any moment.
Yeah.
So then you have to stop doing it right then. So you should. That's one of the reasons that we suggested not doing it at all, is that undoing it will be very hard.
Yeah,
so,
it's one of those things I say, never do something once you're not willing to do over and over again.
I know.
Once you start down that path, it is so
Yeah, it's bad. And, because, well, I don't even want to go down that rabbit hole, but the most important thing that you need to do is, once you've taken all of this stuff, use it to build a complete incident response plan. Please. Because part of an incident response plan, a business continuity, disaster recovery stuff, is the post-event review. So if you didn't have the other stuff and you kind of built it as you went, do the post-event review and put the stake in the ground that this is our plan. Please. I beg of you.
Yes, do that post-mortem.
It's a golden opportunity to solve a problem that most people struggle with anyway.
Yeah, I'm just excited that I don't have to hear anybody else say, well, that's not likely to happen.
Like the group that told you before all of this, when you're trying to get everybody ready and we don't do infectious disease. That's not going to bother us.
Yeah. So I don't understand how this is going to affect us. Yeah. These are the same people that are calling now, and they're like, do you have any extra laptops? Do you have... Oh, wait a minute. I didn't think you were going to be affected by this.
Yeah. It's no big deal.
Yeah. So unfortunately, no, you didn't jump on it soon enough. So now we don't have anything.
Right. So it has been an experience for those who had a plan, and there's no way anyone had a plan to be able to do this, to this level of detail. Not, particularly a small business, no. And you've learned. And now you've learned what you can and cannot do, and what you want to make sure you're prepared to handle should you have to do it again. Because the reality is, this thing could go nuts again. And there could be another one that's even more who knows? That's, you buy insurance because you don't know what's going to happen. That's why you have these plans, because you don't know what's going to happen, and you are so much less stressed and so much more capable if you've thought it through and had a plan. I can't tell you the difference between the folks that we had worked with for years going into this and the folks that we met going into this or had just started working with us. it's a night and day difference.
Mm-hmm.
Because if you've thought about it, it makes it a whole lot easier to adapt to whatever's going on.
True.
Well, there you go, David.
She speaks true, I tell you.
True dat. True dat. All right. Yeah.
All righty. So that's our reboot checklist. A lot of things for people to cover. So yeah, don't just run back into the burning building. There's a lot of work that still needs to be done to make sure you're okay.
Yeah, definitely. And cannot stress enough the importance of taking the time to scan and evaluate and make sure you're not infected.
Yeah. Probably a good idea. So take your IT people and say, look, we're starting back next week. So we're going to give you a week ahead of time to go in, do some reconnaissance, make sure everything's clear.
Yeah. You want to make sure that, and if you just, I got a guy or you got the MSP, like Mr. Elliot, what, Randy?
Yeah.
I don't know. Anyways, that isn't doing that much. You need to call a security firm to see what's going on. Your general, I'm just going to run something. That's not going to work because there's too many variables.
Yep.
You need to contact a forensics company. David deals with this kind of stuff. He would know how to do it. Contact us if you want to know some folks. We're not going to just start throwing names around because there's a lot of differences, but we work with a lot of forensics groups.
Yep.
So we would be happy to share the ones that we know. You got to reach out, though.
Mm-hmm.
I don't want to get in no trouble. All right. There you go, David.
All righty. That is our show for today, folks. So remember to follow us, share us out on your favorite social media site, rate us on our podcasting app, help us spread the word. You want to have some more sheriffs in town out there. So as always, you can send any of your communications to us at contact@helpmewithhippa.com. And that is with 1 P. Anyway, for Donna and myself, remember, HIPAA is not about compliance. It's about patient care.
You've been listening to the Help Me with HIPAA podcast, hosted by Donna Grindle and David Sims. The show created to help you with HIPAA. For more information or to ask us a question, visit our website at helpmewithhipaa.com. Neither Donna Grindle or David Sims are attorneys, and they do not offer binding legal advice concerning regulatory compliance. The information in this podcast should not be relied upon or construed as legal advice in any way. Consult your attorney for legal advice concerning compliance with HIPAA regulations.